the flood situation in Indonesia, and especially the impact on children. Desi Kowyane Ukar is CEO of Save the Children Indonesia. She joins us live now from Jakarta. Desi, thank you very much once again for joining us. I want to start by asking you about how extreme weather-induced trauma is different for children compared to adults. I'm assuming there is a difference. And, is it worse? And can it leave them with, I guess, permanent psychological and physiological scars?
Yeah, I think I would like to start with floods and landslide triggered by Cyclone Senyar have devastated Aceh and Sumatra, affecting more than 3 million people, including children, as you mentioned. Tens of thousands of children are out of school. Most of them lost their homes and daily routines overnight. I was actually in Sumatra a couple of days ago, and I met with them. I met with the children and families whom are now living in crowded shelters, facing risk of illness and protection concern. Children are always the most vulnerable in disaster, and this situation is no different. Like you mentioned, it is even like severe than what impacted the adult. In Aceh and Sumatra, more than 759 people have been killed, and about 650 are still missing after torrential rain triggered landslide and caused widespread flooding, with the north of the island most affected.
Desi, Save the Children works extensively with vulnerable groups. And what are you hearing from children and families who've been displaced by those floods?
Yeah, I think I would also like to share that in the aftermath of an emergency of this scale, children face long-term consequences on both their physical and emotional well-being. Health risks are rising due to overcrowded shelter, as I mentioned, poor sanitation, and limited access to clean water. Children already reporting coughing, fever, and stress, but one of the biggest impact we are seeing is on education. The flood have damaged or closed hundreds of schools, and many schools buildings are now being used for evacuation shelter. And as a result, tens of thousands of children are currently out of school. This means their learning has stopped indefinitely, and we know from previous disaster that prolonged disruption increases the risk of children labor, early marriage, and long-term learning losses.
Desi, as you continue with your efforts to reach displaced children, how are parents and also the government reacting, to your efforts? Do they understand and welcome it, appreciate it? Or is it more about just give me food, give me a roof over my head, and I'll be happy?
Yeah, I think we are collaborating at the moment with many stakeholders. I mean, we try to mobilize many others to join us with our responses. Of course, coordination is required. We always push in the time of emergency that children needs to be prioritized. They cry for help, and we should all be there, join hands to give the support they needed. So I mean, as I mentioned, children are paying the highest price of crisis they did not create.
Yeah, indeed. And the crisis will set them back in terms of development, for a couple of years there. In the immediate term right now, we're seeing, reports of children developing fevers. They're lacking access to basic medicines. What health risks are you most worried about for the children in the coming days? I'm also seeing reports of, contaminated water, so there's no clean drinking water, sanitation issues as well. This obviously can give rise to a lot of virus and I suppose health issues.
Yeah, I think children are already reporting coughing, but I'm worried about flu, of course, influenza and diarrhea and malaria, of course, and dengue. I guess above all as well is their mental state. So they are facing a stress at the moment. So we are also trying to help them on providing psychological aid for them. So those are my worry for a long-term disaster like this. I mean, as I mentioned, children are always the most vulnerable and the most impacted compared to us adults.
So, Desi, I want to ask you, you talked about, the health concerns, you talked about the education concerns. I'm wondering, how much time do you have? How soon must the kids return to school? Obviously, the sooner the better, but is there a cutoff point after which it becomes really detrimental, to their development and could lead to other issues that we saw, for example, with the pandemic as well, when, schools were basically disrupted?
Yeah. For us, I mean, the most important now to, of course, life saving, the basic needs that they need at the moment urgently, and then taking care of their health and their mental well-being. But in all the responses that we are having, we are also like always thinking and putting importance on the education of children. We usually like even put a temporary education shelter, and also like ensuring even in the limitation children are still learning, children not left behind on their education. And if you ask me how soon, it is an immediate needs, but as you know, the situation now facing uncertainty, we cannot guarantee how long children can go back to school. Thus I'm also like needed everyone to work hand in hand with us to ensure that we can recover and ensure that children are back to school as soon as possible.
Yeah, Desi, and just a last question before we go. I know you talked a bit about collaboration with the government. How would you assess the coordination between humanitarian organizations like yours as well as the Indonesian government so far?
We are coordinating, especially in the provincial and district level. I even met with the Bupati or the head of district level. So the coordination is, we are trying our best because, as I mentioned as well, we cannot do it alone. And what we are doing as well in every collaboration that we are having, that children are in the center of it. So we need to listen from children. We need to understand their needs. We need to hear from them and even like involve them in the solution that we are trying to do.
All right, Desi, we do appreciate, what you and your organization is trying to do in Indonesia. Desi Kowiane Uka, CEO of Save the Children Indonesia. Thank you so much for joining us